Hey everyone, it's Steve from Uric Pharmacy with another hopefully helpful health video. Today I want to talk about prostate cancer. The prostate is part of the male reproductive system. It's a small gland normally the size of a walnut and it's divided into left and right lobes. It's found in front of the rectum just below the bladder and surrounds the urethra, that little tube that carries urine and semen through the penis. Over our lifetime, the prostate will grow and this is quite normal. Prostate cancer occurs when the cells of the prostate grow at a rate that is uncontrolled and they no longer function as healthy cells. They have an abnormal structure and unfortunately don't work the way that normal cells work. Prostate cancer normally grows slowly and usually stays in the prostate gland where it may not cause serious harm. Sometimes the cancer can be more aggressive, growing quickly and spreading outside of the gland. Detecting cancer early, while it's still in the prostate, gives the best prognosis and chance for survival. Early on, there may be no symptoms. As the disease grows or progresses, men may see symptoms such as trouble urinating, decreased force of stream, that is, not being able to hit the back of the bowl, and sometimes blood in the urine or pain in the pelvis. It's estimated that 1 in 8 men will be diagnosed with prostate cancer in their lifetime, and 4,100 men will die in Canada each year, making it the most common form of cancer in men. The diagnosis of prostate cancer begins with a medical history and a physical exam. Your doctor will discuss any symptoms as well as risk factors. While we don't know who will develop prostate cancer, we know there are certain risk factors. Some risks are non-modifiable, meaning we can't change them. For example, having a family history of prostate cancer. Your risk will be higher if a first-degree relative, that is a father or brother, has had prostate cancer, and your risk increases with each additional first-degree relative. Gentlemen of African or Caribbean backgrounds are at higher risk, while men of Asian descent appear to be at lower risk. Age is the strongest risk factor for prostate cancer. We know the risk increases after the age of 50, and most cases are diagnosed after the age of 65. While we can't change our age, our family history, or ethnicity, there are some factors that are modifiable or things that we can change. Looking at our diet, men who eat a low-fiber, high-fat diet may be at greater risk of prostate cancer. Saturated fats may increase testosterone production and promote the growth of prostate cells. Achieving and maintaining a healthy weight can reduce your risk. This involves a proper diet and regular exercise. Once you've discussed symptoms and risk factors with your doctor, the next step is a physical examination, which involves a digital rectal exam. The doctor will place a gloved finger into the rectum to feel the prostate gland through the wall of the rectum, feeling for any change in the size of the gland or presence of lumps. A blood test called prostate-specific antigen, or PSA, may also be ordered. The PSA is a tumor marker, and while it may be elevated in non-cancer conditions, it is helpful to diagnose and measure the treatment of prostate cancer. In addition, ultrasound and biopsy are used to confirm the diagnosis and determine how aggressively the cancer is likely to spread. A number of treatment options exist, including active surveillance, which is simply to wait and watch with slowly growing tumors, to surgery, radiation, hormones, and chemotherapy. You should discuss these options with your physician. Thanks again for watching the video. Hopefully you learned something. If you like the video or have suggestions for future videos, you can post them below or email us. Have a great day, take care of yourselves and each other.